Yes, Kirsty, make no mistake, with every day that is going by, this is a situation which is getting worse. First things first, infections and deaths today, as Kirsty was saying, was bleak, record-breaking on both counts. Take a look at this. This is new cases and new deaths throughout the UK. Cases, as you can see, climbed to a new record high at 68,053. The weekly average for cases is up 30%. Go back just a 3 weeks, as you can see there, it's climbed so rapidly, and they've risen 92%. So they've nearly doubled in that time. Deaths as well, you can see on this graph here, also reached a new high today, over 1,300 dying within 28 days of a positive test. Some of that's a little bit of catching up over record keeping from the holidays, but the trend, the red line you can see here, unmistakably climbing ever higher. Let's look at hospitalisation too. In every nation of the UK, you can see here on England, Scotland, Wales and Northern Ireland, the number of COVID patients in hospital in each different nation. There are now more or very nearly more COVID patients in hospitals in every nation than there were at the April peak. England, 49% more than the English April peak. You can see way above there. Scotland, they're the only ones just under their April peak, but only by, as you can see, a couple of percent. And you can see Wales down here has more than double the number of patients in hospital with COVID than they had at their April peak. And Northern Ireland, well, they've got 69% more COVID patients than they had at their April peak, but it's dipping a little bit. The worst picture of all, though, is in London, not only in hospital numbers, but infection too. This is regional positivity rate and the percentage of people in each region of England which are testing positive. There's some evidence it's dipping a little bit in London, but the data we got today shows that it's still way out in front of the rest of the population. 3% of the population testing positive, 1 in 30. But in some areas of London, like Barking and Dagenham, that's over 6% or 1 in 15 people testing positive for the virus in that part of London. All of this is why a major incident was declared in the capital today and why hospitals really are at their limit, and don't let anyone tell you otherwise.
If you look at London, there's some parts where you could already be quite worried that the service isn't coping. You know, there are pockets where operations that would never be cancelled. Even at the height of the worst winter, you would never see operations for some cancers where every delay means a worse clinical outcome for a patient already being cancelled. You wouldn't see clinical staff in critical care units being asked to care for the number of patients that they're being asked to care for at the moment. So you're already seeing pockets of extreme pressure in London that are only going to spread.
And remember, we haven't even seen the full impact of Christmas yet. That's to come. And the worrying thing about all of this as well is that we have some evidence that the policy mechanism to deal with this, the lockdown, might not be quite as effective as it was previously. For example, this is some data that the Transport for London has given Newsnight today, compares tube use in the first week of the first lockdown. That's in the red graph, part of the graph you can see there, compared to the blue part of the graph, which is this week, tube use this week. You can see, to take yesterday, this week, there were 1.19 million tube journeys made yesterday. The equivalent day in the equivalent lockdown in March, there was only about 500,000, so a big increase. Likewise, this data looks a bit more complicated, also provided to Newsnight, a survey of 6,000 teachers. What it shows is the dramatic difference in school attendance in January this year, this lockdown, to March last year. Again, the red part of the graph is the lockdown last year. You can see all of the attendance is bunched towards the early part of this graph. Tiny numbers, either very few students appearing in school at all, or between, as you can see there, 1 and 5%. This time, much more up this part of the graph. 1 in 5 schools are seeing 20 to 30% of their kids come through the doors. Some, down here, are seeing more than half. And if the old measures aren't working as well as they did before, there's a worry that if they don't fall significantly, then there aren't that many more levers left to pull.
You can have an effect on it, and lockdown definitely will have an effect on it. But we need to do more than just make it plateau out, because at the moment, you know, plateauing out at the same levels as it's already at would mean that we carry on with over 1,000 deaths a day, and we can't do that. So we do need to decrease it.
And that is the real challenge here, to significantly bring down prevalence of the virus, and to do it soon. In their darkest moments right now, epidemiologists are concerned that the combination of the new variant, lockdown fatigue and the ubiquity of the virus means that that might not happen, with all the consequences for our health service therein. Kirsty.
Lewis, thanks very much. Well, in a moment, we'll speak to Professor Susan Meeke, who sits on SAGE and is Director of the Centre for Behavioural Change at University College London, and Dr. Dan Poulter, Conservative MP and psychiatrist who still works in the NHS as a mental health doctor. But first we're going to hear from Rupert Pearce, an ICU consultant working at a major London hospital. Good evening to all of you, but first of all, Rupert Pearce, you are seeing the impact on your hospital daily. How much worse do you think it's going to get?
We don't know. We're very worried about how much worse it's going to get. You talked a lot about the first wave in your peak. It's worth noting that the peak of admissions in the first wave occurred within a couple of 3 weeks maybe, and was down to quite low levels by 4 or 5 weeks. This wave has been going for more than 8 weeks, and we still haven't reached the peak. So that's really the main reason why we're seeing such vast numbers of patients in hospital. And the services on the ground are really tremendously stretched now.
And can you see a difference in terms of the patients coming and the deterioration of their condition?
It's hard on the ground to see epidemiological patterns in the types of patients who come in. I think that one of the important messages is this appears to be a disease of all adult ages. We're seeing patients in their 20s, 30s, 40s, 50s, as well as older patients as well. And the idea that this may not affect you because you're too healthy is really a fallacy. And
in terms of the staff in your ICU, you're seeing people coming forward, volunteering, untrained people coming in to help because you need them.
Yes, so we would normally run very strictly with one trained intensive care nurse per each patient. We've had to dilute that down as far as one nurse to 3 patients, or even one nurse to 4. And we have to backfill that space with trained nurses from other areas who aren't intensive care experts, medical students, and this weekend when I was working, even consultant colleagues had to step in to work alongside our nursing colleagues to deliver routine patients.
Sorry to interrupt. I know you haven't really spoken out much before now, but you've decided to speak out now. Why do you think this is so critical now?
Well, I'm very worried that we've reached a peak and we're really not seeing the kind of behaviour that we saw in the first wave. And I and many of my colleagues in medicine are extremely worried that the peak, this surge wave is just going to carry on rising and rising, and that we'll reach a point where the NHS simply won't be able to cope with it. And we're particularly worried about opinion leaders chipping away at public confidence in the lockdown measures and the public health measures that we've introduced to try and control the problem. And personally, I find it particularly frustrating as a doctor to see MPs questioning the logic of public health measures when maybe their local hospital in their constituency is full to bursting with patients with
Thank you very much, Professor Pearce. I need to turn right now to Dan Poulter and Susan Meeke. Dan Poulter, just picking up on that, what Professor Pearce has described is actually very grave and indeed frightening.
It is, and the situation on the front line is really tough at the moment, particularly in London, but in many other parts of the country as well, in the southeast, in the east of England. What was unusual today was the fact that the NHS were accustomed to sometimes diverting people from a very busy hospital where there's a major incident, but a major incident was declared across all of London's hospitals, and the situation, unfortunately, is going to get worse before it gets better. So it's a really difficult situation. It's the first time, I think, in my time working in the NHS that I have been genuinely concerned about how we are going to manage to continue to care for our patients in the way that we'd like to, because we are very near to being overwhelmed.
Well, you're near to being overwhelmed, so does something have to happen very quickly in terms of adjusting the lockdown?
Well, certainly, if you look at the measures that are in place now compared to the lockdown in March, and we weren't dealing with a mutant strain which is more easily transmissible back in March, it was a stricter lockdown in March, and there are more relaxed rules about childcare.
Yes, and well, let me bring in Susan Meeke on that. Do you think the rules need to change, or people need to comply with the rules who are not complying now, perhaps because they're just exhausted and actually find it incredibly difficult financially and indeed mentally?
Well, the evidence shows that people are adhering to the rules just as much as they were back in June, in the summertime. But what we are seeing is many people out and about, as we've heard earlier in the programme. But if you think about the much more lockdown we have this time, it's not surprising. We have mass gatherings in terms of nurseries and religious events. We have household contact with cleaners, tradespeople, nannies going in and out of houses. We have a very wide definition of critical worker now. So we've heard that, up to 30% of classes. So people are still going into schools. All of that means much busier public transport. And you put all of that together, and it means that we're getting really mixed messages. On the one hand, the government's saying, we're locking down, stay at home. But on the other hand, they're saying, go out and do all these jobs. And if you think that compared to March, we now are in colder weather, so the virus survives longer, plus people spend much more time indoors where they're more at risk of aerosol transmission. And we have a variant that's somewhere between 50 and 70% more infectious. We should be having a stricter lockdown, yet we've got a more lax lockdown.
Well, Dan Poulter, we heard from Professor Pearce that there's a danger of the NHS being overwhelmed. And given what Susan Meeke said, and that, in fact, at Christmas, there were very rapid changes to the Christmas get-together rules, these rules are not designed to be revisited for another fortnight. But do you think, in the light of what both practitioners are saying, and indeed people like you are saying, who are both a politician and a doctor, that the government actually needs to make an adjustment now to stop the NHS being overwhelmed?
Yes, I do. And we need to look at things like, for example, rules on, for example, mass congregations for worship. Those things have got to be looked at.
Do you think they should be stopped now?
Well, if it was down to me, yes, I would stop it. And we also need to look at the way this wider definition of key worker that's been put in place in terms of schooling. And we've also got to look at possibly some of these issues around support bubbles and family bubbles, because the risk is with 1 in 3 people being effectively asymptomatic, so having the virus but not knowing they've got it. You could well be mixing in a family bubble and infecting people who you love and care about. And that's something that's happening every day at the moment. And we need to look at this and take some, I think, more urgent action, because the worst thing that we could see is a situation where it gets to the point where the NHS is systemically, not just in 1 or 2 hospitals, but systemically unable to cope for a prolonged period of time. And that's what we are at the moment facing. So we need to revisit some of these measures and put in place tougher measures. They're difficult, but it's about saving lives, and it's about making sure that the NHS is there for those who are really sick.
But we know that some people are desperate because they just do not have enough money to cope, despite measures being put in place. So the government presumably would have to move very quickly in a short-term way to fill that gap if they want people, if they're desperately keen that people do not leave their homes.
Absolutely. And one thing, and I'm part of a group of MPs on the all-party parliamentary group on coronavirus, we have specifically made some recommendations to government about exactly that we need to find ways of better supporting people who will find it very economically tough and hard not to be at work. And that's an important part of this package. So what I'd hope to hear from is some more from the Chancellor next week, coupled with some further tightening of the measures that we already have in place, because the economics have got to go hand in hand with the healthcare restrictions, because that's very important.
And Susan Meeke, from your point of view, people presumably realise just how dangerous this new variant is. Do you think if they were asked to make a bigger sacrifice within the next 2 weeks, that they would do it?
Well, that's the history of the pandemic. When people see that there's a really big threat and that what they can do can make a difference, and they have the support to make that difference, they will do it. But we mustn't forget that one of the most important things is keeping those people who are infected or might be affected away from the rest of the population, which was the whole purpose of test, trace and isolate. We mustn't forget that. It's so important to get that up and running, but that requires supported isolation. Other countries pay people to stay at home. Other countries offer free hotel accommodation and visits every day when somebody is isolating for the 10 days to see if they're all right. Do they need any practical help with provisions or helping with their rubbish or whatever it might be? We're not doing any of these things in this country. We're not being serious.